lots going on, but this former Burley doctor imprisoned for using unapproved Chinese breast implants. A former Burley doctor was sentenced in U.S. District Court to 7 months in prison for receipt and delivery of misbranded devices, U.S. Attorney Bart M. Davis announced Tuesday. U.S. District Judge B. Lynn Windmill also sentenced Temporary Patterson to 1 year of supervised release after his prison sentence and ordered him to pay $8,200 of restitution and a $10,000 fine. From March 2014 through April 2015, Patterson knowingly implanted 9 pairs of misbranded breast implants shipped from China and unapproved by the Food and Drug Administration, according to court records. Those poor women. Patterson used various documents, including brochures and handouts, to mislead patients into wrongly believing they would receive FDA-approved implants. In February 2015, Patterson implanted a misbranded pair of Chinese implants to a patient. Before and after the surgery, Patterson showed the patient FDA-approved implants labeling and told her she received a specific brand of FDA-approved implants. Patterson altered the patient's records to show she received a different size implant than she received so that the implants could match the size of the FDA-approved implants he told the patient he used. Members of the community trust their medical providers to use FDA-approved products, Davis said. Doctors who choose to mislead their patients and use unapproved products will be prosecuted. I commend the efforts of the FDA Office of Criminal Investigations for their work. Food and Drug Administration Office of Criminal Investigation investigated the case with the help of Health and Human Service Office of Inspector General. Lewiston School District forms diversity group. A school district in north-central Idaho has formed a group to examine district and state policies on harassment and intimidation after receiving reports of racist incidents involving students. The Lewiston Tribune reports Lewiston School District Director of Student Services, Kimberly Eimers, discussed the diversity group at a school board meeting Monday night. The group consists of 14 people and includes Jeff Gilroy, the former Director of Diversity Education at Washington State University, who will serve as an expert that can help guide the process. Last month, community members Christine Jorgens told the board that the group of students chased a minority classmate from an elementary school to her home while yelling racial slurs. On Monday, Jorgen thanked the board for taking the issue seriously and encouraged others to share any racist incidents they experience at future school board meetings. Idaho Energy Department signed deal on spent nuclear fuel. Now that's the INEL. This is actually located out in the big desert of Idaho, up north by Arco, I believe. Idaho has granted a conditional waiver to the U.S. Department of Energy that could allow research quantities of spent nuclear fuel into the state after years of blocking such shipments. The agreement announced Thursday by Governor Brad Little and Attorney General Lawrence Watson, both Republicans, means the Idaho National Laboratory could get spent fuel for experiments as part of a U.S. strategy to expand nuclear power. The waiver to a 1995 agreement requires the Energy Department to first prove it can process and remove radioactive liquid waste stored above an Idaho aquifer that supplies water to farms and cities. The Energy Department has spent some $600 million trying to do that, reporting progress earlier this year. Idaho benefits because the deal requires earlier removal of other nuclear waste at the 890 square mile site west of Idaho Falls. This might not be the INEL, but BYU Idaho requiring students on Medicaid to also buy student health plans, and they won't say why. By Nathan Brown and Victoria Fondo. I'm so bad with names. Brigham Young University, Idaho has stopped accepting Medicaid insurance to waive the student health plan, and so far the university won't say why. Some students at the university in Rexburg, which is affiliated with the Church of Jesus Christ of Latter-day Saints, took to social media earlier this week after going to the Student Health Care Center and finding out that even if they have Medicaid coverage, they still would need to buy a student health plan, which costs $536 per semester for an individual and $2,130 for a family. BYU Idaho spokesman Brett Crandall declined to comment on the change when contacted by the Post-Register and the Standard Journal. The student newspaper Scroll reported recently that the health center and university public relations wouldn't comment to its reporter either, and that students contacting the health center were being told by staff that they had been instructed to not give a reason for the change. Casey Adrelin, a senior who, along with her husband, will be covered by Medicaid when Medicaid expansions take effect in January 1st, 2020, said she and her husband will now have to get student health plans for coverage we're not going to be using. Edgerlin said she was surprised to find out that the university won't accept Medicaid. When she and her husband were given a waiver form last month, she said they were told Medicaid would be accepted. BYU Idaho uses a trimester system where students are in classes for 2 trimesters and are off for 1. Edgerlin said she and her husband will have to pay for a student plan even during the periods when they aren't taking classes. They don't allow a lapse in coverage the whole time you have continuing student status, she said. Some students said on social media and told Scroll that when they contacted the Student Health Center initially, they were told the Church Board of Education told them to no longer accept Medicaid. However, an LDS church spokesman referred to the Post-Register back to BYU Idaho, and BYU Provo said that it would still take Medicaid as an acceptable substitute for a student health plan. This is official. There is no change at BYU Provo, the university tweeted from its official account. Medicaid and Medicare will continue to meet the health coverage requirement at BYU here in Provo. BYU Provo declined to weigh in on the situation in Rexburg, telling people who responded to the tweet they should contact BYU Idaho directly. Mike, a married BYU Idaho student who asked that his last name not be used, has 1 toddler with his wife and another baby on the way. Next year, they'll qualify for Medicaid, but knowing that the university won't accept it is frustrating. I just do not think that it makes sense if you need to be on Medicaid, Mike said. The school insurance isn't good anyway. It doesn't really do anything for you. The Medicaid being better and free, I don't understand what the school's issue is with having it. Most colleges and universities in the United States require students to have health insurance. Mike said he always figured it was required to make sure they were safe and covered if anything ever happened. The Medicaid is mostly important for my wife and the babies, he said, because out-of-pocket costs for birth can be, from what I understand, $5,000. Oh, it's even more than that, man. To pay a fraction of that is really great. According to Norma Valdez, Madison Memorial Hospital financial advisor, a vaginal birth can cost up to $7,500. A C-section is $9,000. And there is a healthy baby charge of $2,000. If the baby needs extra care, the cost goes up. Valdez said with Medicaid, the cost goes down depending on the program, but often it pays for everything. According to BYU Idaho Student Health Plan for the 2018-2019, non-student spouses must pay a deductible of $4,750 before maternity expenses will be covered. It's kind of frustrating, said Mike, whose wife isn't a student. We'll be able to figure it out, but if you have to be on Medicaid, it's because you're a student and poor. Doug McBride, Director of Marketing and Public Relations at Madison Memorial, said the hospital is in constant communication with BYU Idaho on many topics. I do not recall any discussion for this Medicaid issue specifically, but am perfectly confident that their decision was based on sound judgment, he said. As of August, 232,437 Idahoans were enrolled in Medicaid, according to data from the Federal Centers for Medicare and Medicaid Services. The university's decision to stop accepting Medicaid comes just before an estimated 91,000 Idahoans will gain Medicaid coverage due to the ballot initiative voters approved in November 2018, expanding the program's coverage to everyone making up to 138% of the poverty level. And I now qualify in this. I was one of those people because I have autoimmune diseases but I was in this gray area where I couldn't get covered, but I couldn't afford to pay it. So many BYU Idaho students likely qualify for expanded Medicaid. Statistical surveys routinely show Madison County as the poorest in Idaho due to the student population. Even if they're forced to buy the student health plan, Medicaid-eligible students will start to be able to receive Medicaid, said Nikki Forbeen, spokeswoman for the State Department of Health and Welfare. She said the student health insurance will become the primary payer and Medicaid would become the secondary payer. It would be up to the provider, she said, to coordinate benefits between the two. So that's weird. I'm gonna wait. I bet they're gonna come out with a statement, and so when that comes out, I'll probably throw that in the Idaho News sometime. All right.